Hello, I'm Dr. Brandt Gibson. Today I want to talk to you about sesamoiditis. One of the problems with sesamoiditis is basically people understanding what it is. So I'm going to answer those 4 questions as well. So sesamoiditis, before you can understand exactly what sesamoiditis is, you need to understand what the sesamoids are. There are 2 bones that sit right underneath the big toe that are basically the kneecap for the big toe. And those bones actually have their own joint between the sesamoids, those 2 little bones, and the metatarsal, the first metatarsal head. And what can happen in that joint is you can get inflammation, which can cause pain. That can be caused by a couple different reasons. The reason this will happen could be injury. If you were to injure the sesamoids, that can actually cause a sesamoiditis. If you were to get an arthritis of some sort, that can cause sesamoiditis. Basically, if you were to sprain or strain the tendons in that area, that can cause a sesamoiditis. Basically, what you're doing is you're getting inflammation between the sesamoid bone and the first metatarsal, which causes significant pain, arthritis pain, or inflammation pain that causes discomfort, causes problems. So 3, what can you do for this at home? So if you have sesamoiditis, you say, okay, I'm walking and I have pretty significant pain underneath the big toe, then things that you can do. If you were to limit motion of that foot, so if you were to go into a more rigid type shoe where you're not rolling across that big toe, you're not causing that motion, you're basically limiting that motion like this, because every time you do that, the sesamoids move back and forth. That's one thing you can do. You can take the pressure off of it by what types of shoes you're wearing and so forth. Of course, avoiding heels or anything that's going to put you right on that ball of that foot could be an issue, or padding it in such a way so you take the pressure off ball of foot, that can do it. So 4 ways you go to the doctor. The truth is, a lot of times with sesamoiditis, you're just saying, I hurt underneath that. There's not anything I'm doing at home that actually helps. Not the anti-inflammatories, not the ice, not any of those kind of things. And you actually go in to be seen because the pain is continuing to be a problem. And then the doctor will do multiple different options, has multiple different things. They can give you something called a dancer pad, which takes the pressure off. It actually is a cutout right underneath those metatarsal, right underneath the sesamoids, basically underneath the first metatarsal head, so that you get no pressure on those bones when you walk. A lot of times that will take enough of the pressure off that allows it to recover. You can do a cortisone shot to the joint between the sesamoid and the first metatarsal. You can do laser, where you actually treat that area to decrease pain, decrease swelling, and stimulate healing. Really, those are the most common things that can be done by a doctor. Very rarely would you do anything else, such as surgery or those kind of things, because if it's a true sesamoiditis and not a sesamoid fracture or some other problem, there's no surgery that really can treat it. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 183.